Now, we have a highly knowledgeable and well-experienced resource person with us. Mrs. P.S. Lakshmi Sarkar, Senior Occupational Therapist, Kola Hospital, Oman, has been associated very closely and voluntarily with the Center for Special Needs Functioning at Indian School Muscat in assessing, evaluating children with various disabilities since the year 2004. In 2013, she was nominated as the member of Management Committee Apex Center by the Board of Indian Schools. She has been serving as an SMC member for CSE at Indian School Muscat since the year 2021. Her cosmopolitan background and analytical interest in other cultures, together with good command of local language, Arabic, along with English, Hindi, and 4 other Indian languages, have helped her excel in handling clients with utmost care and comfort. A noted speaker and workshop conductor, she has published several articles in newspapers and magazines. May I request Mrs. P.S. Lakshmi Sarkar to speak on allied healthcare professions.
A very good afternoon to all of you. Are you all sleepy, hungry? I think you all had lunch, right? Okay. So, my topic for today is allied health professions. Is it echoing or the volume is fine? Yeah. So, allied health professions. All of you are science stream or mixed? Okay. So basically what I'll be talking about is for science stream students and especially children who have taken up bio stream, right? So allied health professions, any student would like to talk about healthcare? Do you know the professions associated with healthcare? Well, let's go ahead and you'll get more of the clarity. So, yeah, you can start the slide, please. Next. If you see the overview of any healthcare system, right? Right from an emergency situation a person faces at any situation or any site other than home, hospital, at the work areas, on a road, whatever the emergency situation is. The first healthcare people who assemble, you call an emergency number and the ambulatory system comes, take them to the hospital, and immediately a specialized team starts working with the person, the patient. And that's inpatient care, the nurses, the doctors, the therapist, and the diagnostic team. Once the vitals are settled, you see, it is the restorative phase, next phase, and it can prolong to quite some time. So all this while, there are specialized and super specialized healthcare professionals continuously working with the person or the patient, or even you could call a client, till they go back home safe with full function. Next slide. So if you see a healthcare system, basically, there is 3 portions of it. The medical, or the physicians and the surgeons. The next major chunk is the nursing facility. And the third one, the lesser known, lesser obvious, but a very important chunk of healthcare system, and that is the allied health professions. Next, please. So before we proceed, I would like to clarify a few terms which are very loosely or, at times not correctly used as well. So, and also I will be talking about these in my lecture through. First of all is the paramedical. Paramedical, allied health, and rehabilitation. We are going to cover this today. What is paramedical? Paramedical actually is the emergency team or the ambulatory team that comes immediately to rescue at the site. They are specifically trained and specialized in particular areas of healthcare, like resuscitation, ventilation, or ambulation or mobility. That means safely handling the patient and carrying him to the hospital in the best position possible. So these are the paramedical staff. They are ambulatory, they are basically specialized in particular areas and skills, and they are short-term courses, right? The next one we go to is allied health professions. Allied health professions occupy 60% of the healthcare system. So what are these allied healthcare professionals? The next one. When we talk about allied healthcare, it means allied healthcare are parallelly running professions to the physicians and the surgeons. They have their own techniques of treating, diagnosing, and testing a patient for different disease conditions and injuries, right? So these are allied health professions, and they are many in number, and there's a lot of upcoming professions every now and then in this section of healthcare. So the next one. For example of allied healthcare are audiologists, speech and language therapists, occupational therapists, physiotherapists, prosthetic and orthotists, dentistry, ophthalmologists, and optometrists are just to name a few, right? The next one. So when we see the allied health professions, it's basically divided into broad categories, and that is, you see the technicians and the assistants, what I said, they have to be supervised while they are working. They cannot independently work, and they are not specialists. The next category is the therapists and the technologists. The therapists work independently. They have their own professional and proficient skills of identifying, screening, diagnosing, and treating different conditions of neurology, orthopedic, and all other medical areas. When we see the broad distribution of allied health professions, you see this is the distribution. Education-wise, there are graduates and diplomas. Diplomas cover the technician and the assistant positions. These could be involved in every specialty. And the next one is the therapists or the clinicians. They are the clinical staff of any healthcare system. And the other one under the graduate system is the diagnostic area of healthcare. They are called the technologists, like the radiographers, the pharmacists, the microbiologist, the lab technician, technology specialist, not assistants. So these are all coming under technologists. The next step. And a major chunk in allied health professions who are specifically dealing with treatment techniques and are under clinicians are rehabilitation staff or the rehabilitation professionals or rehab team. This rehab team, anyone can say what is rehabilitation? Any idea what is rehab? Any science student has any idea, precursor knowledge? Any general term rehabilitation means habilitating them back to their normal life. That how is it done? By restoring their lost functions or damaged areas of health, right? So this is rehabilitation. It's a continuous process. In rehab team, we don't have clients who leave us for a long time. It's a dynamic team. That means there is a core rehab team without whom the rehab is not possible. But apart from that, based on conditions, specific patient clientele, or specific situations, we have other team members or professionals who are being added into the rehab team for their specialty. So that's why rehab team is very dynamic, and it has to keep changing or adding on professionals. Nevertheless, there is a core rehab team that has minimum of these therapists or professionals who have to always be involved. The next one. So I have already spoken of the rehabilitation. Depending on the resources and the centers, the rehab team members are there. Next one. The main components that a rehab professional has to look into is the person per se specific, first of all, his body, his mind, and his functional skills, and the environment overall. So these are basically the goals a rehab profession has to set and look into. Next. And these are some of the examples of a rehabilitation team. Again, physiotherapist, occupational therapist, orthotic and prosthetic, and the list is actually long. But next one. But if you go to the core rehab team, these are the specialists without which a rehab team or rehab service cannot be complete. The physiotherapists, audiologists, occupational therapists, psychologists, and a social worker. Next one. And what we, as a rehab professional, you have to look into the medical aspect of the person, the psychological aspect of the person, the social aspect, and the vocational aspect. So that means if, for example, even two patients come with hip fracture, or rather a femur bone, because you'll understand that better, fracture. But even those two with similar fracture will be different for us when we look into their rehab aspect. Because a student with a femur fracture, or an industry worker or a housewife with a femur fracture, the whole rehabilitation approach is totally different. So that's where this aspect or this model is very, very important for rehab professional. Why I'm emphasizing on all this is because if in your career path you prove or you prefer to take these professions, you have to be multifaceted, you have to be very aware, very keen, and have those precursor aspects in you as a professional. Next. These are some of the examples of how each one works. The physiotherapist is the first one, prosthetic, orthotic, fitting an artificial limb. The psychologist helping vent out all the negative feelings before the therapy starts and starts getting in. The speech therapist helping with oral motor functions, the occupational therapist working with functional skills, and the social worker helping with whatever facilities are required post-trauma, post-injury, or post-illness to go back to their environment with their new equipment. The next one. And these are some of the facilities you see pediatric kind of setup in rehabilitation. So what is the eligibility? You all science students with basic subjects, or the core subjects rather, physics, chemistry, biology, and in some of the professions, mathematics is required, right? And with a 60% aggregate, and then you have entrance exams. In various colleges, there are umpteen private colleges in India and around the world, and a handful of government colleges in India as well, with limitation in seats, of course. So you have to really prove yourself. And the course goes like, it's a 4.5 years course ideally, 4 years with a heavy course curriculum of around 40 subjects to be studied over 4 years of line. And it, of course, whatever I said, that you have to be keen listener or observer or pick points easily, work with a team, all that is definitely polished all through your course along with your course subjects. And then the internship helps you work in various setups like pediatrics, psychiatry, all the various setups it helps in and prepares you for the job per se. Next one, please. So these are some of the subjects, but there are 40 plus subjects along 4 years of course you have to study. Next. So the scope of any allied health profession, and specifically rehab professionals, is advocacy of diagnosis and treatment. It has to incorporate promotion of health by awareness programs to community and to patient population, to educations, and research. Next. And because rehabilitation is a teamwork, right? So there are different ways you have to work in team. Different types of teams are there. It's usually a multidisciplinary approach. All these professionals or disciplines are present in a rehab setup, and then it's a complete process. They have to work in coordination and tandem with each other. And when we say transdisciplinary, it is like one particular condition, how each discipline is going to add on their services has to be done in clinical meetings, and that's how they approach a patient. Intradisciplinary, within each discipline, you have specializations. Like I have a specialization in pediatrics. Similarly, people specialize in neuro, ortho, gynae, plastic and reconstructive, and many more disciplines. So, and interdisciplinary is again, like if we have, an orthopedic center, then all specialities of various disciplines of ortho specialization will be teamed up. So this is the way a rehab team works. Next. So as I already mentioned to you, some of the traits which are very, very important to pick up on these professional career path is you have to be extremely efficient, very good in your core subjects. You have to have good listening power and umpteen amount of patience, and also a keen observer, because our assessments take sometimes 1 hour, sometimes even a week's time. So you literally have to test your patience in them, and you have to be very dedicated kind of a person to work in this profession. But having said this, it's really pays off. It's a very rewarding path, and you actually enjoy working here. Next. And again, the furthermore skills, as I said, creative and critical thinking has to be involved, along with your strong knowledge base of all subjects. And of course, at this stage, the 11th and the 12th, the core subjects have to be very strong. You have to have a very good grip on your core subjects to further ahead in these career paths. Next. Yeah, so you have a very specialized job description in this. Because it's a teamwork, you have to be very ethical, and you have to follow your job specialization techniques and path. Next. So where do you actually work? You may work in hospitals, government, private, DRC, CRC setups. You may have your own clinic or get associated with some clinic, and you can work in schools. A lot of schools these days, and the good ones, I would say, have a complete rehab team to bridge the children with intellectual and learning disabilities, to bridge them to mainstream education. Sports and athletic organizations, and companies and industries, right? So the career path again is either you can be associated with public health, that is healthcare system. You could be in education, teaching lecturerships in colleges, or into research. The next. So, as we all know, we have faced the pandemic recently. We know that the healthcare system was the most into action, the most needed, and the seeked for. So these jobs are highly in demand. Next one. And if you see the Bureau of Labor Statistics projects, that 15% from 2019 to 29, it amounts to around 2.4 million professionals are needed very soon. And as I already mentioned to you, 60% of healthcare is allied health, and around 50% of the allied health is rehab team. So you see the amount of demand. Employment scope never ends. And the most important aspect of these professions, you make a difference in a life. And that's the most rewarding part of these professions. The clients or the patients never forget you in life. and they are moving along with you for years together. Some of the patients I have are from 10 years, and they keep coming with their functional requirements every now and then. They have grown literally with me and the therapy, and their needs keep coming new, and we keep fulfilling them to therapeutic and adaptations. So, the next one. As I already mentioned, there's no saturation in these kind of professions. It's very, very novel and of course noble, and there is so much of innovation associated with these professions. You can think a lot because every client, every patient of similar conditions is different. So you have to plan person per se and very specific to the patient. And though it is very important chunk of healthcare, it helps a lot in a balanced lifestyle for the professional as well, because we have minimum situations of emergency. So this is the upside of the profession, and it's rewarding. I have a small video to be played. You can just watch it. It's a very short one for just little more insight into these professions.
Here at Loma Linda University, I'm training to be a part of the rehab team. This includes physical therapy, occupational therapy, and speech and language pathology.
Physical therapy helps patients by promoting mobility and stability, reducing pain, restoring function, and preventing disability.
Through creative problem solving, occupational therapy helps people across the lifespan to participate in their meaningful everyday activities regardless of disease or disability. They strive to understand the whole person, including habits and routines, to help develop their skills for the job of living.
Speech-language pathologists work to help kids and adults communicate effectively so that others can understand them and they can understand others. They also work with individuals who have feeding and swallowing problems.
Being part of the rehab team is an amazing experience because I get to help the athlete get back on the court.
I give someone the chance to become independent again.
I work with an elementary school student to make them confident when communicating.
At Loma Linda University, all three programs have been around for more than 55 years, preparing students to make an impact on individuals' lives through compassionate care.
The rehab programs are housed on one campus, allowing opportunities for interaction and collaboration. In the classroom, I feel like the professors really care for us and want us to succeed.
They also provide learning experiences outside of the classrooms with interactive labs and a variety of clinical sites.
I really enjoy the campus life here at Loma Linda.
We are encouraged to live a balanced life through spirituality, exercise, diet, and social activities. This emphasis on whole person care is something that sets Loma Linda apart.
Loma Linda provides service learning opportunities that continue the teaching and healing ministry of Jesus Christ both locally and internationally.
Faith is infused in all aspects of Loma Linda. From professors praying in the classroom to the weekly university-wide chapel service, I'm reminded every day of what's truly important.
Loma Linda is a unique place.
It's the emphasis on whole person care.
It's the many ways to gain service learning and clinical experience.
It's the faculty, staff, and classmates who help me succeed every day.
And it's you who will come to Loma Linda University and help us make an impact in our communities and around the world.
Well, so that was just an overview of a rehab team. And thank you very much for your patience during this afternoon, after your heavy lunch. Any questions?
Good afternoon, ma'am. So, my name is Nandana A.S. from grade 11. I'm studying in Indian School, Dasit. So, my question is, how many years is rehabilitation course? How many years it is?
Yeah. See, most of the universities offer 4.5 years of courses, right? And some of the government institutes in India, like where we studied, is 5.5 years course. And but in the most of them are 4.5 years courses. Some government provides 5.5 years course, where the internship goes even to 1 year. Okay, but most of the colleges are 6 months internship and 4 years of courses, mostly the privates. And abroad, the course curriculum is, it's different for all disciplines. So various countries have various programs, but it's a minimal of 4.5 wherever you go for a graduation course. Masters, in some countries have 1 year, but it's again, most of the places it's 2 years of masters, right? And a 2 years of PhD program.
Okay, ma'am. Thank you, ma'am.
Welcome.
Good afternoon, ma'am. I am A.B. Jacob. I am studying class 12 in this ISD. Ma'am, I have a question. What is the most preferred degree or course that one should complete to pursue a career in allied professional healthcare, more specifically in the rehabilitation team?
Fine. See, I wouldn't, anybody for that matter, even my own children, I wouldn't recommend a profession to them, right? Because each one has their own caliber, their own view of themselves. So you have to ask yourself, 5 years down the line, what I would like to see myself accomplished in or full with money, with rewards for life, with job satisfaction, with a fulfilled life, right? So this all depends on what kind of personality yours is. So see, any personality, when I don't mean it in a negative way, I mean it in a positive way. Because there are children or there are personals who wouldn't like to stick to one particular kind of mundane, routine kind of a job. So some prefer that, correct? So when I say, some professions, I wouldn't name any, but they have specific principles and protocols and they have to follow that and they move ahead all through their years. When it comes to rehab profession, I am in Oman for the past 20 years. Every morning, 6:30 or 7 say, I hit the road and I have that excitement bubbling in me. Why? Because I think of all my list of children, because I'm in pediatrics, I'm specialized in pediatrics. I think of all my children who are going to come to me today. We have 13 slots of appointments per day, right? In that, a few are walk-in and a few are new. When I drive to my hospital, I work for Khola Hospital, I get so excited thinking, oh my God, that child is going to come, and then I told the mother to try out this with him. I'm so excited to know it works or doesn't. And every child is different. Every person is different, and therefore my own techniques work in a different way for every person. So that's how our profession is new each day for me. Even after 20 years, I get excited to go actually. I don't get tired. And these kind of jobs, our jobs are actually, if you say the therapy jobs, the physiotherapy and the occupational therapy. The speech therapy is not so physically tiring, but occupational therapy and physiotherapy are very physically tiring professions. Even that tiring just stays to physical. We don't get emotionally or mentally tired ever. That's the kind of reward we get. But the downside is it may not be as paying as many other professions. If you take maths and go for software engineering, or take commerce and go for a CA, you may not draw like that. Depends on what you look for, right? A person looks not for a paycheck, but a rewarding life, a fulfilled life, a very, very nice job satisfaction. I would say go into rehab team. None other than that. But again, it depends on what you look for, right? So you have to repeatedly ask yourself questions. Start it from 11th standard itself. That, okay, fine. First of all, you have to streamline from the 10th. What subjects I like? Grossly. Science, commerce, humanities. Science, fine. Just enter 11th. When you enter 11th, and of course in 10th you have to think, I like healthcare or I like maths, numbers. Then you distribute and then you take up that in your 11th. Once you are in the 11th in the bio stream, you start thinking, healthcare, what do I want? Some personalities don't like interventional techniques like surgeries. All are not comfortable. Then you ask yourself, next what? What do I look for? And definitely there is no limitation in earning in this also if you are going for a private setup, like you own your own clinic. There's no end. But then there's no balance in life, right? Some don't mind that. Some want balance as well. So based on what you look for, just keep asking yourself question, what I look for myself down the line 5 years, 10 years, how I want to see myself. I want to see myself recognized for my service and not for my money. Or I want to be recognized and strong and secured financially. Either way, I'm just saying, it may happen in anything, all these may be possible also. But I'm saying how you have to analyze what you like, right? So this is how you have to go ahead. Nobody will name any profession that this is the best, because each one is experiencing a different profession at that point of time.
So, thank you, ma'am.
Good afternoon, ma'am. I am Aryan, studying in Indian School, Dasit, class 9. I have two questions, but we can start with, how do emergency numbers actually work? And what extent can the paramedic staff go to save a person?
Emergency services?
Staff, emergency staff, as in the paramedics.
Yeah. See, emergency services, it's multifactorial. Like how fast they reach you, first of all, right? How fast they reach you depends on which place we are talking about, which country or which system we are talking about. That being the time part. Second part is the efficiency. Emergency or the paramedical staff are exceptionally trained for particular skills. As I mentioned, resuscitation team. You can be assured that if they come well in time, their resuscitation capacities and their excellence in that job will definitely save the patient, right? Now, what is the type of condition the emergency is? Suppose there's a stroke patient. Stroke has some golden moments when you can revert the process. What has happened, there's a clot basically in the brain, and that has, disrupted the function of the brain as well as the body. So it depends on how fast they come to you, and they have saved the life. But what is happening, the pathology in the brain, you cannot judge by the efficiency of an emergency team, because that process is continuously happening. So these people are responsible for safely transporting the patient in an alive situation to a hospital situation, right? So it is multifactorial, but yes, the ambulatories or the emergency or the paramedical staff are excellently trained in specific skills. And when you call an emergency line, they will ask you what the problem is. Based on the problem, they send the team who is excellent in that. If there is a fracture or they're suspecting a road traffic accident, it will be multiple injuries, multiple types of injuries. So they will have the whole team coming. Depend on what kind of emergency you call them for, and the team comes. And they are excellent in that particular set of skills. Right?
Thank you, ma'am.
What's your second? You had another question? Sorry.
No, ma'am.
Yeah.
Thanks.
Hello. Sorry, good afternoon, ma'am. I would like to know what exactly does an occupational therapist do, and more about post-trauma care.
Post-trauma care. Yeah. Occupational therapy is my domain. I've been in the profession for the past 22 years. I would say one single sentence, okay? And then I will definitely explain to you. Physiotherapists and occupational therapists are working very closely with each other, though they are totally different professions. If a physiotherapist is making you walk after your disease or your chronic illness condition, an occupational therapist makes you dance. Could you make a little bit of difference between the two? Okay. Physiotherapist is working with the physical aspects, bringing back all your core functional areas of health, like muscle strength, your range of motion of all the joints, your mobility is getting back through a physiotherapist. Then, I'll give you a simple example. Like suppose there is a stroke patient and they have undergone physiotherapy and the patient starts walking, and there is one side paralysis in stroke, either right or left. So they may start walking but the gait is not perfect. They upper limb or the hand, they will use, but the fine motor will still not come. So what happens? He has extreme strength in his hands because of the exercise regime of a physiotherapy. But he may not even do simple activities like buttoning his shirt, okay, or writing, for that matter, go back to his job to write, or even feed himself independently. So where an occupational therapist comes is when we have to retrain the person in his specific functions. And that's where the model comes, the medical aspect, treating the, whatever the core problems in the patient is because of stroke. Suppose, for example, the tone part, there is spasticity. These are technical terms, but there is tightness basically in all his joints. So we are seeing to it that that normalizes first, and then how he goes back to his function, how he goes back to his vocation after all the recovery phase. So that functional plus the cognitive, higher cognitive skills, like understanding a situation, memory, the judgment, the abstract thinking. Okay? If a person has to drive to, say, example, ISD school or Lulu, what do? You think I have to go take out my car, I have to drive from this, go under the bridge, and I reach. That abstract thinking, it's not in front, but you are imagining and you are doing. That is lost in a lot of neurological conditions. And unless that comes back, the patient cannot actually go back to his function. Either his vocation, that is his job, or his day-to-day functioning, like simple self-care. So all these areas, the sensory aspects, by the way, okay? The vibration sense, the temperature, the touch, all these get disrupted and haywire. All that have to set them back. So that these three major areas and fine motor skills are occupational therapist's job. We see to it that the person is handed over to his day-to-day functions safely as well as perfectly. And whenever we say rehab, we use the near normal condition. We also know there are residual, most of the time there are residual challenges left. So we say near normal condition. Okay? So that is basically an occupational therapist's job. Anything else? I think we're done. Thank you so much for your patient listening.
Thank you, madam, for sharing your invaluable inputs with us.
I request our beloved principal and Mrs. Ruxana Sadiq, Head Co-Curricular and Inclusive Education Subcommittee, School Management Committee, Indian School Darset, to come onto the stage to present a memento and a certificate to Mrs. Lakshmi Sarkar. Thank you, madam, for doing the honors. this, we have come to the end of today's session. Do join us for Career Expo on Friday and Saturday at Al Falaj. Thank you. Adieu.